Asked for an update on the investigation, which he said was launched last month following the death of the children, Dr. Anthony said during his COVID update, health personnel undertaking the investigation have not yet concluded their findings.
Persons from the ministry and persons from the Georgetown Hospital who have undertaken that investigation. So they have been looking at the charts and examining the signs and symptoms. And they're yet to make conclusions on how we can improve this.
He added that the children died while in transit to the hospitals.
And that's because they had signs and symptoms before, but I guess their caretakers, parents, probably did not interpret this as a serious disease, and therefore might have given the normal treatment. Unfortunately, when they decided to seek medical care, it was too late.
The ministry will issue guidelines outlining signs and symptoms parents can look out for to determine whether or not a child might have COVID-19. In excess of 15 children would have died from COVID-19 since the start of the pandemic almost 2 years ago. Some of them had existing underlying conditions such as cancer, which was compounded by the COVID-19 diagnosis. While the suspected Omicron cases locally are taking a downward trend, the unvaccinated and partially vaccinated are requiring hospitalization upon contracting the disease. There has been a decline in hospitalizations, which stand at 136, as well as deaths and new infections. Vaccination numbers continue to increase steadily. 425,333 persons have been administered first doses as of Wednesday, while 315,909 have been fully immunized. Booster shots are also climbing, with 41,091 persons already receiving them. Dr. Anthony said that his ministry is making steps to procure vaccines for children between the ages of 5 to 11 years old, as well as those from the 6 months to 5 years age group.
Pfizer would have submitted to the FDA in the U.S. For permission to get a vaccine that would be for children between 6 months and 5 years. Hopefully that would be approved by sometime by the end of this month. And once that is approved, they will start using that vaccine. We, of course, we're trying to access these vaccines.
Temika Rodney reporting for the HGP Nightly News.